Good evening, everyone, and good morning in Asia. What is cardiometabolic syndrome? What are some of the challenges? Can you manage with functional medicine? We are going to talk about all these questions in our session with Dr. Rolando Balburia. Dr. Rolando is MD and board certified physician in general internal medicine. He is a certified functional medicine practitioner with IFM as well. Dr. Rolando is also certified in nutritional medicine and anti-aging medicine with the European board. I am Amita from Nourish Doc, a platform for natural and integrative medicine. I am excited to introduce you to Dr. Rolando, who's joining us live from Philippines. Welcome, Dr. Rolando.
Good afternoon, Amita. Thank you for inviting me. Good afternoon, everyone. Thank you for joining us for this webinar.
Okay, let's get started.
Okay, so I'll talk about what we call cardiometabolic syndrome. Well, previously when I was still practicing my illness medicine practice focused on illness, it was used to be known as metabolic syndrome, wherein metabolic syndrome was just simply a cluster of findings that is present on a patient, wherein when you have 3 out of the 5, you are classified as having metabolic syndrome. And previously, we thought only that this is the pre-morbid condition wherein people will have heart attack or will have heart diseases is starting from. But now it's actually these two conditions, cardiometabolic conditions, are actually a manifestations of several biological, biochemical, and physiological conditions happening to a person. So it's not really just a list of findings. And one of the prominent things that can really contribute to why a person will develop cardiometabolic syndrome is when they have what we call insulin resistance. Of course, you're very familiar when you have high blood pressure, high blood cholesterol, but this insulin resistance is something that is overlooked because oftentimes this really doesn't manifest with any symptoms. But this morning, I'll discuss with you why it's important for us to know, and if you do have what we call insulin resistance. So next slide, please. So there. So this actually is a good representation to consider if someone, like in my practice, I see a lot of patients when I started practicing functional medicine, patients who have what I call 3MD syndrome. They have multiple doctors, they're seeing multiple, because they have multiple diseases and they take multiple drugs. But many of them, just by looking at their body composition, and they have all of these 3 conditions. They have high blood sugar, high blood pressure, and high blood cholesterol. And at the same time, you can see that they have what we call central obesity or visceral adiposity or central obesity. Well, this kind of fat, so it's considered to be the 5th vital sign because this is really going to serve as a perpetuating factor. If you do have all of these 3 conditions and you are not addressing this condition in you, if you do have excess abdominal fats, or if you are a female, if your waist circumference, that's the easiest way to find out if you have possibility of an excess abdominal fat, is if you are a female and your waist circumference is more than 31 inches. Well, that's for Asians. I think you have a higher number for Americans, but for Asians, if you're 31 inches, your waist circumference, if you're a female, is 31 inches or more. And for males, if it's 35 inches or more, then you do really need to know your body composition and to find out what is your visceral adiposity score. Because as I mentioned, this particular fat is not just an ordinary fat. It's a more dangerous form of fat. So let's find out why. So next slide, please. Okay, why? Well, because this is, as I mentioned, it's a high risk fat. Number one, it will have an impact on your cholesterol metabolism. It will predispose further for more free fatty acid oxidation, as well as it will predispose you to more of a pro-inflammatory predisposition. Okay, and at the same time, more than this fat would actually contribute as well to lowering what we call adiponectin. Adiponectin is a hormone that will help you or help your insulin to be sensitive in doing its function. Now, remember that insulin is what we utilize in order to transport glucose, right? It's like the key, to be able to enter the cell wall. But if you are a lower level of adiponectin, that will impact on the sensitivity of your insulin, leading to a condition that we call insulin resistance. Okay, so next slide, please. So this is a good picture. Well, I got this is courtesy of Genova. This is their slides. These are not my slides. But you see, if you have high blood sugar, high blood pressure, and high blood cholesterol, and oftentimes this is just managed through drugs, right? So like they'll give you statins, they give you metformin to lower down your blood sugar. But if these conditions or these findings is associated with an excess abdominal fats, and you're not addressing that, as I've said, it's going to be like a vicious cycle for you. This abdominal obesity is going to predispose you to why your cholesterol, why your blood sugar, why your blood pressure will still, despite the fact that it is controlled, does not represent that indeed you are healthy. You may be able to control your blood pressure, but that does not equate to mean that your blood vessel is healthy, right? So it can continue to get damaged. And remember that one of the that heart attack does not begin when you already have a plaque in your blood vessel. Heart attack begins when you damage the wall of your blood vessel, including what we call endothelium, right? So if you're just going to address the symptom or the sign of the problem and you're not addressing the root cause of the problem, this abdominal obesity is what will lead for you to develop what we call insulin resistance. And insulin resistance is what will lead for you to have what we call resistant fat loss. Why some people, despite going on a diet, despite trying to exercise every day, and yet they're having difficulty losing their weight or losing their fat. And if this particular abdominal obesity and excessive level of insulin in the blood persists, this would activate a response from our immune system that triggers the response of what we call inflammation. So this inflammation is actually a protective and defensive response by our immune system when it perceives that something is sort of like a danger to us, right? So the problem with this inflammation, if it persists, it will lead to more activation of your insulin resistance, and more insulin resistance, more difficult for you to lose weight. That's why so many people have what we call diabesity. So people who are already diagnosed with diabetes, and but despite that diagnosis, despite so many drugs that they're taking, all the complications accompanying their conditions, both hypertension and diabetes, still happens to them. Many of them still have kidney failure. Many of them suffers from heart attack and stroke because to begin with, they never address the root causes why they develop diabetes and hypertension and heart disease in the first place. So that's why it's important for us to address the root cause. So there are so many root causes of insulin resistance, not just visceral adiposity, but this is one very obvious. I mean, you don't need to a subspecialist doctors to find out your risk about this. So if you do have visceral adiposity or excess visceral adiposity, then the possibility that you do have insulin resistance is very, very high. Hence, we need to address and enhance your insulin responsiveness. Next slide, please. So this is also one way, for you to see whether you do have the possibility of insulin resistance, because you can measure your fasting insulin. But if you don't have time, especially now that a lot of us cannot go out of our house or you're scared to go to the hospital, you can go back to your old blood chemistry results, like especially your cholesterol level results. Especially some of us, as I mentioned before, they only look at metabolic syndrome as a cluster findings, that if you do have low HDL, if you have high LDL, and if you have a fasting blood sugar of more than 100, if your blood pressure is more than 120/80, if you have 3 out of this cluster of findings, then you have metabolic syndrome. And that's why some of you even repeat determining their blood cholesterol level. Some of my patients, they repeat it every month, no? Some every 3 months. Even though they're not changing their diet, they're not changing the root causes why they have problems with their cholesterol metabolism. So if you do have your blood chemistry results, even if it's a year ago, try to check your triglycerides and your HDL ratio. And if it's more than 8, definitely that's diagnostic of insulin resistance. Or if it's at least at the range between 3 to 5, then there could be a possibility of suggestive insulin resistance. Then that's a good thing that you do measure your fasting insulin level. So you can measure that. That's different from your fasting blood sugar. No? So fasting insulin is that our insulin level in the blood becomes abnormal decades before your fasting blood sugar will become abnormal. So if you're relying on a normal fasting blood sugar for you to say that you really have diabetes or you have a higher risk of developing diabetes or what they call pre-diabetes, you are in for a surprise, because prior to the abnormal, for your fasting blood sugar becoming abnormal, your fasting insulin is the first one to elevate first. So next slide, please. So that's it. No? So you see, it will take 4 to 7 years, but there are some studies that showed even like 14 years. No? And sometimes even prior to the abnormalities of the fasting blood sugar, there are some patients that they will already develop some of the microvascular and macrovascular complications. I've seen patients in my practice wherein they find out that they're diabetic or their blood sugar is abnormal because they had a stroke or they had a heart attack. They didn't know that they had a problem with their blood sugar. But as I mentioned, this particular insulin resistance happens decades even before your fasting blood sugar becomes abnormal, or even before, and sometimes this precedes the complications accompanying long-standing diabetes beforehand. So that's why if you really want to avoid developing cardiometabolic risk and predisposition, then you need to know whether you are insulin resistant or is your insulin level optimal. Or if you don't have the time to have your fasting insulin level checked, or it's not covered by your insurance, as I mentioned, just check your triglyceride HDL ratio, or just look at the pattern. Look at the pattern of your fasting blood sugar. An optimal fasting blood sugar is really not below 100. It really should be below 81. No, especially if you're still very young, that's the optimal fasting blood sugar. But if your fasting blood sugar is already above that, that is also a good key or a good sign that possibly consider the possibility that you have insulin resistance. Or as I mentioned, measure your waist to hip circumference. Now, if you know your waist circumference is elevated more than 31 or 32 inches or more than 35 inches for Caucasians, then measure as well your hip circumference and compute for your waist to hip ratio. If it's more than 1, your waist to hip ratio, that is also could be a suggestive sign that you do have the possibility of insulin resistance. So if you really want to be healthy and you really want to avoid being diabetic or developing a lot of those cardiometabolic conditions and predispositions, then this is one predictive parameters that you can see, that you can determine in order for you to avoid developing all of these chronic diseases. So next slide, please. So because it's important for you to know if you are insulin resistant, because it's not only diabetes that could likely develop in you if this condition persists in you. So as you can see here, these are cluster of diseases. I think this is about 12 conditions and diseases. And if we will apply and adapt the organ-based approach to all of these diseases, the naming and the blaming of diseases by the conventional approach, how many doctors will you be seeing? So of course you'll see for dyslipidemia, hypertension, atherosclerosis, you'll be seeing the cardiologist. For your diabetes, you'll be seeing an endocrinologist. For if you have a stroke, you'll be seeing a neurologist. Osteoporosis, I don't know, maybe an orthopedic surgeon or your gynecologist. ESRD is a nephrologist, fatty liver, a gastroenterologist, erectile dysfunction, a urologist, of course, malignancy for oncology. So this is what I call the 3MD syndrome: multiple doctors, multiple diseases, and multiple drugs. Of course, many of these doctors will manage all of these conditions separately and independently. They will provide different interventions. But the root cause of so many conditions and diseases: insulin resistance and wide abdominal obesity. Remember, your weight is not just a number. Your weight has a composition. So your weight has a composition of muscle mass, has a composition of fat mass, and that fat mass, it's important for us to know how it is distributed in our fat mass within the central part of our body, the visceral obesity or central obesity or visceral adiposity. That is already a risk factor for you to develop so many of these cardiometabolic conditions, risk, and predisposition. So you can do so many ways to address and avoid developing so many chronic diseases. And we know that even before this pandemic happened in the US or here in the world, we already have an epidemic of chronic diseases, chronic and lifestyle-related diseases like diabetes, hypertension, heart disease, even cancer. No, so they're saying that cancer have already overtaken heart disease as the #1 premature killer of people around the world. But I'm not sure if that is something to be happy about. But either or, it's not a good thing. So if you really want to avoid, then begin by looking at your body composition or your body shape. Okay, so next slide, please. So there. So, well, this is the slide that, as I mentioned, when I started my practice here in the Philippines, in our country, these were my first patient. In fact, up to now, about 70 to 80% of my patients are like this. These are the ones that have gotten tired of the conventional approach of having multiple doctors, taking multiple drugs because they're given multiple diseases. Of course, in functional medicine, we do not look at your body from an organ perspective. We were trained to look at the body from a cellular perspective. So that's why in managing your health, there's a big difference versus managing your individual diseases. If you want to manage your diseases, then well and good. You have to see all of these subspecialist doctors. But if you want to avoid diseases, or if you want to reverse your diseases, your chronic lifestyle-related diseases, then we cannot apply the same approach. We cannot apply the same science of anatomy, pathology, pharmacology, and surgery. We need to apply a different science when managing your health or restoring back your health or optimizing your health, not your diseases. We need to use the science of biology, physiology, and as well as the science of biochemistry. That's why in my practice, or in the integrative medicine practice, or in the naturopathic practice, we use a lot of food as medicine. In functional medicine, we're trained to give food plans, we're trained to give recipes or food ingredients. So because we use food as medicine, we use exercise as medicine, we use nature as medicine, we use meditation, mind-body medicine, we use sleep as medicine. Because the three, if you have 3MD syndrome or you're suffering from all of these chronic diseases, you need to look at how are you managing the different positive determinants of your health. And that is your nutrition, your exercise, and your sleep. Those are the 3 positive determinants why a person can really guarantee that he or she will remain healthy. You know? Or there are also some negative determinants of health. Of course, chronic stress, your weight, too much of it, excessive weight, too little, weight also is going to be a negative determinant of being about your health. And at the same time, of course, look at your environmental exposure and your toxicity levels. Now, of course, not even our food is not safe at this point in time. Many of our foods are laden with pesticides and chemicals that can actually disrupt your hormones, leading to why you will develop insulin resistance. As I mentioned, there are so many root causes. There are biological root causes why a person develop insulin resistance. And if you have this, no, if you fit the criteria of having a 3MD syndrome, consider the possibility that you do have insulin resistance, and especially if you have not known it yet. And that is where we could begin in order for you to restore, manage, and optimize your health. Or better yet, if you can really take back your health. So thank you. So if you have questions for me, I'll be happy to answer it.
Thank you so much, Dr. Rolando. Maybe you could talk about, how functional medicine, you talked about the diet, sleep, and the exercise, right? 3 things. So, so if someone is suffering from cardiometabolic syndrome, how much time would it take them to get to normal? And what is the steps, what is the process?
Oh, well, our body is such an adaptive and intelligent system. I think because we have an amazing creator. I've seen patients, I have patients when they started with me, as long as they really adhere to the food plan. Of course, in functional medicine, we have what they call a cardiometabolic food plan. And if they really indeed manage and utilize many of those therapeutic foods that we identify for them to eat, and do away those foods that are really causing for them to why they're developing insulin resistance, why they're developing chronic inflammation. It takes about 3 months to 12 weeks. I've seen it. No, the very first patient I've handled when I started my practice here in the Philippines was someone with cardiometabolic risk. Really, she's actually is considered a candidate for dialysis. And he didn't want to go through dialysis because his son went there in San Francisco to undergo a kidney transplant when his son was 7 years old, developed an autoimmune disease that damaged the kidney. And he didn't want to go to dialysis because he saw his son prior to the transplant undergo dialysis. And he said, and he saw one of my patients that I reversed diabetes, and he came to me. In fact, he has 3MD syndrome. He has diabetes, he has sleep apnea, he has obesity. He was actually sleeping in front of me when he was consulting. It was the wife that I was talking to. And I told him, sir, before we start our session, I'll have a question. What is your expectation of me as a doctor? Do you expect me to manage your diabetes? Do you expect me to manage your chronic kidney problem? Because I'm not that doctor. But do you expect me to manage your food, your exercise, your sleep? Then that's me. Because if that is your expectation, I want to ask, are you willing to stop your soda, your drinking of soda, and are you willing to stop your smoking? Because if your answer is a resounding no, then let's stop the session because you don't need me. But he said yes, because he said he didn't want really to go through dialysis. If he could find a way. His creatinine was at 2.7 when I started with him. But he was diabetic, so they were being considered already to be prepared for it. I told him, okay, I'll manage your food. No? So we put him on a food delivery system. Wherein he will not eat any food except for the ones that are really included in the recipes of a cardiometabolic food plan, wherein we identify the different therapeutic foods. So, and he came back to me 1.5 months after. The creatinine from 2.7 went down to 1.2. Okay, and he lost about 30 pounds after 1.5 months because, of course, he stopped all those pro-inflammatory foods, and he gained back his energy. So it takes about 12 weeks, no, if you're really going to be able to provide the different substrates that your system needs, especially if you can measure it. Of course, in integrative medicine diagnostic test. No? So in this particular patient, I was able to really measure the precise need of his body, of his system towards different nutrients like B vitamins. Vitamin D level was very low. He has elevated oxidative stress. He has amino acid deficiency. So we corrected all of that, and in 3 weeks, we've been able to reverse many of his chronic diseases. In fact, when he started with me with 18 drugs. Now, of course, he has 6 doctors seeing him: urologists, endocrinologists, cardiologists, nephrologists, sleep specialists, and an orthopedic surgeon for the backbone problem because he was obese. And we were able to reduce the medication. In 3 months' time, he was down to just 5 drugs because many of it, he doesn't need it anymore. I was not the one who discontinued it. It was his attending doctors, because every time that he takes all the oral hypoglycemic medication, including the injection of the insulin, he will develop hypoglycemia. But since he was already correcting his nutrition, and since his nutrition was corrected, his energy level came back, and he got more energy for exercise, which contributed furthermore to the weight loss. And after that, we reduced his insulin resistance and enhanced his insulin responsiveness. So three months to some patients, but maybe depending on your partnership with us. Of course, in managing your health, it's not like a it's a one-sided partnership. It's a partnership, really. It's a two-way partnership. So you need to participate and contribute to managing your health.
It's a very inspiring story and very encouraging for users, who are suffering from hypertension or any cardiometabolic syndrome. Dr. Rolando has been narrating success story for one of his clients. So if there are any questions or any feedback, please let us know. And you're welcome to reach us. We've written the email here. We've written our website as well. Dr. Rolando is in Philippines, but he's board certified with IFM US. So the other thing is, you mentioned one more question before I let you go, is that what kind of test would you recommend for someone who has this syndrome? Like there'd be a lot of different tests that you mentioned about measuring the proportion of your waist to the hip. That's one of the things that you're obese or you have a high body mass index. What are there any other tests that you would also do to check their thyroid or other things, or just
Well, depends on. I always based my management or the comprehensiveness of my management, AMITA, on the health goals of the patient. That's the first important question that I ask my patients who sees me. So if they can afford it and they can they can be covered for it by their insurance, then I do request for functional diagnostics, especially for patients like this wherein they're really at risk or high risk for cardiometabolic events like a heart attack or stroke. I would definitely investigate the health of the blood vessel. I would determine some inflammatory markers like homocysteine, like HSCRP. So some of those conventional markers. But at the same time, if they can afford to be covered for functional diagnostics, I will request for an advanced cholesterol testing, because it's not enough just to know the number of the cholesterol. It's also important to know the particle size and the particle concentration of your cholesterol levels, because there's nothing wrong with cholesterol. 70% of the cholesterol that is measured in your blood is actually produced by your own liver. But what is important is to know whether you have oxidized cholesterol and what are the particle size or particle concentration of your cholesterol. Those are the ones that oftentimes I measure to those patients that have cardiometabolic risk and predisposition, because anytime that endothelium gets damaged, that is an equivalent of a cardiac event or a brain attack that could mean the life of my patient. So especially that can lead to what we call premature death. So in the Philippines, like in our country, it's been 30 years since heart attack became #1 premature killer of Filipinos. It's been 30 years. But despite the advancement in our conventional medicine, like we have the most high-tech cath lab. We have 10 or 15 medical societies of cardiologists in the Philippines, and we have so many brands of statins and antihypertensive medication. But the Filipinos remain to be suffering. The number one killer of Filipinos up to present date is still heart attack. Still heart attack, despite all of those advancements, because we are not addressing the root causes.
Well, thank you so much for such an educational session. Thank you so much for joining us live from Philippines.
Yes.
Really appreciate you that. And well, there is hope, as Dr. Rolando narrated some of the success stories, how you can get off medication, not completely, but at least reduce the medication, right, Dr. Rolando? That the one you said that you can substantially reduce
definitely.
with the help of functional medicine doctor. So please let us know your feedback. Let us know how you like the sessions. And with that, I would like to sign off. Any final comment from you, Dr. Rolando, before we sign off? Anything you would like to say?
Well, just remember that there's a big difference between managing your health versus managing your diseases. So it's really your decision whether you want to wait for the disease to happen, especially for lifestyle-related diseases, or you want to avoid it so that you don't get all the complications and you save the trouble of wasting your resources, but rather, remember, it's not just about lifespan, it's really more of health span. It's good to achieve longevity with vitality.
Yes, that's very beautifully said, longevity and vitality. With that, we'd like to wrap up this session, and then we will also be doing group workshops in September and October timeframe. So maybe Dr. Rolando would come back, and if you're interested, let us know. With that, thank you so much. Signing off, this is Amita. Thank you so much, Dr. Rolando.
Thank you. Thank you, everyone.